unfortunately, I think what we have here, a bill that I'll be voting on next week, I think you kind of know what my vote will be. It's a bill that will make healthcare more expensive and will put the government in charge of what is right now 16% of our economy, the healthcare sector. With that, I'd be happy to answer questions, and I simply want to finish by saying we will leave this here at the Franklin Library. We've arranged with the librarian here to have it available. I couldn't bring more than one copy with me on the plane. That would have cost a lot more money, and I couldn't have carried it. So we have one copy here for the reading room that if people want to go through and read this legislation, you can also go on my website and pull it off there. I probably wouldn't recommend printing it out. You can probably just put it online and read the thing. This is my first opportunity to come back and talk to you because I've been in Washington the whole time. I think there's three things behind that. Number one, keep Republicans in Washington so they can't go to town hall meetings and can't talk to constituents about these things. Number two, keep Democrats in Washington away from constituents so they don't hear about the opposition of this. And that 16 or 17% of our economy, and largely puts it under the control of the federal government. There will be one person, under this bill they call it the Health Care Choices Commissioner, appointed by the President, who is the single regulator of healthcare in America. That person will determine what kind of health insurance you can get at your job, what kind of health insurance you can get outside of your job if you don't get it from your job. And the difference will be whether or not the American people talk to their elected representatives. I think personal visits are probably best, personally, because then you know it's really from the individual. Sometimes it looks like it's a postcard campaign, but if somebody really comes to contact you in their own way, in their own words, however you choose to do that, whether it's a phone call, an email, a letter, personal visit, that is impactful. It does make a difference. It does matter.
What is your personal input percentage for time, letters, and all the other input, output? What is your feed on it?
My last tally was 9-1, I think, against this bill. Yeah, Tom?
Paul, first of all, I just want to say that I can't be more happy to say that you are my congressman and you represent the people of Franklin.
Thanks.
You do a just outstanding. I was a little bit disappointed. I thought you were going to declare that you're running for president today. Because I think you might as well go fix the whole problem.
Yeah. Thanks.
If somebody wants to make copies themselves, they can, but everybody's good. $3,200?
All right, you're all set.
Could you check to see, that comes up and says it's in, but I can't bring it up. It says it's available, but I can't bring it up at any.
Probably, yeah. I think most of the ones like that are going to be a week.
Well, I was interested in all of them. I can probably see them all.
Okay. Did you want to?